Good afternoon and welcome everyone. My name is Sorni Maharjan and I am a registered nurse working in a community health center here in Western Sydney, Australia. Today I'm joined by my colleagues Sharmila, Lydia and Evelyn. And today we will talk about the lack of culturally safe healthcare services for Aboriginal and Torres Strait Islander communities in Australia. And we will also critically discuss how we as nurses can respond. We are very honored to be presenting on this important topic at this nursing conference. So we are going to cover four main areas. First is an overview of health disadvantages faced by Aboriginal and Torres Strait Islander peoples. Second one is barriers to equitable health outcomes. Next is culturally safe and appropriate strategies to overcome these obstacles. And the last one is the role of nurses in implementing culturally safe and appropriate strategies. Before I start our presentation, I would like to take a moment to acknowledge the country on behalf of everyone presenting it with me today. We would like to acknowledge and pay our respects to the traditional custodians of this land, the Darug, Eora, Darawal, and Wiradjuri peoples. We would like to acknowledge the elders past, present, and emerging on whose land we are learning today. In addition to any other Aboriginal or Torres Strait Islander people, for they hold their memories, cultures, and traditions of Aboriginal Australia. And we commit to listening, learning, and acting with respect and cultural humility in our nursing practice. Thank you. So firstly, I'll start by giving an overview of the health disadvantages experienced by Aboriginal and Torres Strait Islander people in Australia. Aboriginal and Torres Strait Islander peoples are the first peoples of Australia and are approximately 3.2% of the Australian population as of 2021. Despite changes in policies and the government's efforts to reduce the health disparities, they're still facing substantial differences in health outcomes as a result of colonization, intergenerational trauma, and continued systemic disadvantages. So, to put this into perspective, based on the data from 2020 to 2022, the life expectancy of Aboriginal and Torres Strait Islander males is 71.9 years, which is 8.8 years less than non-Indigenous males. And females live to 75.6 years, which is 8.1 years less than non-Indigenous females. If you look at the chronic diseases, cardiovascular disease is one of the leading cause of death for Aboriginal and Torres Strait Islander peoples. And there is a high prevalence of other conditions such as type 2 diabetes, chronic kidney disease, respiratory conditions, and cancer. So between 2021 and 2023, 58% of deaths in First Nations people under 75 were potentially avoidable causes, and this was 3 times more common than among non-Indigenous Australians. So likewise, research on mental health also has alarming results. The suicide rate is 30.8 per 100,000 population in 2023, which accounts for 5.2% of all deaths, and this was the largest contributor to overall disease burden for First Nations people. Also, between the years 2020 and 2021, the rate of intentional self-harm hospitalization for Aboriginal and Torres Strait Islander peoples was approximately 3 times higher than that of non-Indigenous Australians. So what is causing all of these differences? Statistics show that 65% of the health gap results from social determinants, such as poverty, unemployment, access to education and healthcare services, in addition to the ongoing impacts of colonization, intergenerational trauma, racism, like I already mentioned, discrimination, and in distrust in health services. So despite national commitments, the report from the 2024 Closing the Gap annual indicates that progress towards narrowing the gap towards the national goal of improving life expectancy is still slower than the national target. Now I'd like to hand over to Sharmila, who will further discuss the barriers to achieving equitable health outcomes among Aboriginal and Torres Strait Islander people. Thank you.
Thank you, Surname. I'm Sarimna Tamang. Now I will start on the major barrier to achieving equitable health outcomes among Aboriginal and Torres Strait Islander peoples due to the lack of culturally safe health care services. First one is racism and discrimination. Experiences of racism and discrimination within the healthcare setting are the major factor contributing to unequal health outcomes for Aboriginal and Torres Strait Islander people. Patients who encounter culturally unsafe and disrespectful care reported feeling of loneliness, isolation, and mistrust in hospital setting and were more likely to leave the uh, before completing the treatment. This reflects a failure of the healthcare system rather than the individual patient choice. Persistent racism within the healthcare contribute to barrier to assessing care, delay intervention, and discourage further engagement with the healthcare services. And second one is culture misunderstanding and poor communication. Another barrier is ineffective communication and culture misunderstanding between healthcare providers and Aboriginal and Torres Strait Islander people, which can negatively affect the quality of the care received. Many patients struggle to understand the complex medical term and feel that the healthcare professionals did not properly inform them regarding their condition, care plan, and expected length of hospital stay. Some patients also feel excluded from hospitals and from the healthcare decision. Important information was withheld and unsupported during the hospital stay. These communication barriers reinforce unequal relationship between patient and healthcare profession and have led to mistrust, frustration, and disengagement. As a result, early self-discharge is chosen by patient. This has interrupted care and increased the chance of high risks of ongoing illness complication and readmission to the hospital. Third one is historical trauma. The impact of the colonization and intergenerational trauma have continued to influence the health and well-being of Aboriginal and Torres Strait Islander people. Suppression of the indigenous culture system and collective identities through settler colonial policies has contributed to ongoing social and psychological disadvantages. Historical experiences of discrimination, exclusion, and forced assimilation has also created long-standing mistrust of government and healthcare system. As a result, some Aboriginal Torres Strait Islander people delay in seeking treatment until medical condition become more serious. Policies often fail to address these inequities because they do not adequately recognize the perspective and the culture values. My last one is rural and remote healthcare barriers. Many Aboriginal and Torres Strait Islander people living in the rural and remote communities have limited access to the healthcare services. Patients with diabetic foot complication often postpone treatment due to the transportation difficulties, limited local healthcare services, and disturbance of mainstream healthcare system. Accessing specialist healthcare may also require traveling long distances away from the family and community support network. While telehealth has increased the providing services in remote area, challenges including poor resources, limited staffing, and communication difficulties can reduce its effectiveness. These barriers have contributed to delayed treatment, preventable complication, and poorer long-term health outcomes. In summary, the lack of culturally safe healthcare services continue to create significant healthcare inequities among Aboriginal and Torres Strait Islander people. Communication difficulties, institutional racism, historical trauma, and limited healthcare services in rural areas have reduced healthcare access and contributed to mistrust and low engagement, which result in poorer health outcomes. Thank you. This is my part about the barrier to equitable health outcomes. Now I would like to my colleague.
Thank you, Shamila, and my name is Lydia. I will now discuss three culturally safe and strengths-based strategies that can be implemented to improve healthcare experiences and outcomes for Aboriginal and Torres Strait Islander peoples. So for Aboriginal and Torres Islander peoples, culturally safe healthcare is important for improving trust, access to healthcare, and overall health outcomes. However, Many Aboriginal peoples have experienced racism, discrimination, and negative healthcare experiences when accessing healthcare services. These experiences may reduce trust in healthcare services and discourage some people from seeking care. As a result, culturally safe and community-focused strategies are important for improving health equity and health outcomes for Aboriginal and Torres Strait Islander peoples. So the first strategy is increasing support for Aboriginal community-controlled health organizations, which can help create a safer and more welcoming healthcare environment for Aboriginal peoples. These organizations provide culturally responsive and community-focused care that reflects the needs and priorities of local communities. Aboriginal-led healthcare services are often more effective because communities are involved in decisions about healthcare services and priorities. This means that healthcare services are more likely to reflect the values, experiences, and needs of local Aboriginal communities. Building trusting relationships and respecting Aboriginal peoples, cultural values are important parts of culturally safe care. This may help increase trust and encourage Aboriginal peoples to engage with healthcare services. And this approach also supports self-determination, which is an important part of improving Indigenous health in Australia. Community-led healthcare approaches may also support self-determination and Aboriginal leadership. So for the second strategy is strengthening the Indigenous healthcare workforce. This includes increasing the number of Aboriginal health workers, Indigenous nurses, and other Indigenous healthcare professionals. Some healthcare services have also prioritized Aboriginal staff to improve culturally appropriate care and communication. Aboriginal health workers and Indigenous nurses may help build trusting relationships and improve communication between patients and healthcare staff. Good communication is important because it can help patients feel heard, respected, and supported when accessing healthcare services. Indigenous health staff also play an important role in supporting Aboriginal patients and families. Increasing the number of Indigenous healthcare workers may help create a safer healthcare environment for Aboriginal peoples. However, Indigenous healthcare workers are still underrepresented in Australia, and racism within healthcare system can affect workforce recruitment and retention. Systemic racism within healthcare system may continue to affect healthcare experiences and health outcomes for Aboriginal peoples. Therefore, more long-term support is needed to strengthen and retain the Indigenous healthcare workforce in Australia. And the third strategy is providing ongoing cultural safety education and anti-racism training for healthcare workers. Education is important for improving culturally safe care because cultural awareness by itself is not enough. Healthcare workers should reflect on their own values, biases, and power within healthcare relationships because this may affect patient experiences and care outcomes. Racism and stereotyping may affect the ability of healthcare workers to provide culturally safe care. The ongoing effect of colonization, racism, and power imbalance may also continue to affect healthcare experiences for Aboriginal peoples. Reflective practice may help healthcare workers recognize and challenge their own stereotypes, assumptions, and unconsciousness bias when caring for Aboriginal patients. This is important because unconsciousness bias can influence communication, decision-making, and patient experiences without healthcare workers also recognizing it. Cultural safety education should continue across healthcare education and clinical practice. Healthcare workers also need to better understand the historical and social factors that continue to affect Aboriginal health today. But these strategies also reflect a strengths-based approach because they recognize the strengths that already exist within Australia communities. Indigenous-led education and healthcare approaches can help promote more positive and respectful understanding for Aboriginal peoples and communities. Strengths-based care values Aboriginal knowledge, community strength, and self-determination instead of only focusing on disadvantage and illness. This approach recognizes that Aboriginal communities already have important strengths, knowledge, and resources that can contribute to positive health outcomes. So in conclusion, supporting Aboriginal community-controlled health organizations, strengthening the Indigenous healthcare workforce, and providing ongoing culture safety education are important strategies for improving culturally safe healthcare. These strategies may help improve trust, healthcare access, and health outcomes for Aboriginal and Torres Strait Islander peoples. Improving Indigenous health outcomes should be the responsibility of the whole healthcare system, not only Aboriginal communities themselves. Improving culturally safe healthcare also requires support and commitment from the wider healthcare system, not only individual healthcare workers. So this is my part. Next to my colleague Evelyn.
Hey, my name is Evelyn. I'm going to be talking about the nursing roles in culturally safe care. Nurses have a key role in implementing culturally safe strategies because they often spend the most time with patients and families. In Aboriginal and Torres Strait Islanders' health, it is important for nurses to create a healthcare environment that's respectful, culturally safe, free from racism, and responsive to the person's cultural, family, and community needs. This directly links to the strategies discussed by Lydia earlier, including Aboriginal community-controlled health organisations, Aboriginal health workers, culturally safe communication, and anti-racism education. So, firstly, nurses can implement culturally safe care by building respectful and trusting therapeutic relationships. This means introducing themselves clearly, listening without judgment, asking the patient about their preferences, and respecting cultural, family, lifestyle, or health decisions. Nurses should understand that patients may not trust healthcare professionals because of colonization, historical trauma, racism, and previous negative experiences in healthcare. Therefore, when an Aboriginal patient delays seeking care, refuses treatment, or wants to leave hospital early, nurses should consider whether the healthcare environment has made the person feel safe, respected, and involved in the care instead of labeling them as non-compliant. This is important because blaming the patient instead of recognizing the systemic barriers is not beneficial for building a therapeutic relationship. Secondly, nurses play an important role in improving communication and shared decision making. Poor communication may exclude Aboriginal and Torres Strait Islander patients from their own care, especially when medical language is complex and rushed. To address this, nurses should use plain language, avoid jargon, check understanding, and give them time to ask questions. Another important consideration is that family and community connection are very important to many Aboriginal and Torres Strait Islander peoples. So, nurses should ask whether the patient wants family members or community support involved. Nurses should also work respectfully with Aboriginal health workers, Aboriginal liaison officers, and interpreters to support culturally appropriate communication when needed. However, nurses should also understand that cultural safety is not Indigenous staff's full responsibility. Cultural safety is the responsibility of all nurses and the wider healthcare system. Thirdly, nurses help implement cultural appropriate care by coordinating referrals and follow up with Aboriginal community controlled health organizations. These services are very important because they are community led and support Aboriginal self determination. Nurses can support this strategy by discharging patients with a clear and safe plan, including referrals, medication education, and follow up care that they have access to. For example, before discharge, nurses should consider whether the patient has access to transport, afford medications, go to appointments, and have support close to home. This is especially important for Aboriginal patients in rural and remote areas because distance from services may delay treatment and increase health risk. Finally, nurses should challenge racism. Cultural safety should not be treated as a one-time training session, speaking up against the discriminatory language or behavior. Reflecting on personal bias and participating in ongoing cultural safety and anti-racism education should always be an important part of the practice. In conclusion, Aboriginal and Torres Strait Islander peoples still face worse health results largely because of a lack of cultural safe healthcare. Things such as bad communication, racism, historical trauma, and a lack of medical resources in rural areas can make these communities feel unwelcome. Improving culturally safe care requires commitment from the entire healthcare system. Nurses play a big role in building trust, improving respectful communication, advocating against racism, and valuing Indigenous leadership. All these efforts help preserve Aboriginal traditions, respect their self determination, and acknowledge their community strength. Thank you.